Hello, Dave Fitzgerald here, Dublin Physiotherapy. I'd like to share a few ideas about core stability with you today. Most of us are familiar with this idea of the core and its relevance to supporting our back. And the core has sort of become synonymous with meaning abdominals, but really the core, as it was originally described, really means how all of the muscles around the abdomen, the lower spine, the front, back and sides of the hips and the groin, how all those muscles work together in order to give us some support. So a lot of you will be familiar with Pilates as a routine, and Pilates is a really excellent form of controlled, safe ways to work your midsection musculature with a view to trying to protect your back. However, we would see a lot of patients in clinic who don't actually transfer the benefit of the exercise that they do either on the floor or on the mat or on the reformer into activities of daily living. And really, of course, that's the main purpose of any training, whether it's in sport or in general life, is that the practice and the techniques that you work on must carry over into activities of daily living. One of the commonest situations we see is people who can lift and carry and do normal things, but then would tell us that they would get an acute episode of back pain just by bending to put on their shoes and socks or pulling a plug or a socket out of a wall. So this essentially is a low load activity. And usually what this tells us is that there's some incoordination in the core musculature in general, which we then have to go and search for to try to identify where the strength deficit is, if that's the case, or whether there's a coordination deficit that's specific to that direction of movement. And that's quite an important idea, because one, core stability may be operating well in some directions of movement, twisting, turning, or loading the spine, but may be vulnerable in bending. So it's very important from a clinical point of view that the mechanism which triggered the onset of problems, that the clinician tries to explore the muscular function in relation to the actual situation that caused it to be problematic. So that's one scenario where people work on isolated training, as in Pilates or any other form of mat-based exercise, and it doesn't transfer over into real life. And there's no real clear explanation as to why that happens. If people are coming from a base where they've got no history of exercise, very often the mere fact of just stimulating the musculature is sufficient to make them feel more confident and to give them a window of safety that they wouldn't have had before. But for people in another category who are generally fit and active and doing things, and they still have this type of vulnerability, usually a generic kind of core strengthening program isn't specific enough. And really, in my view, the approach needs to be to actually explore the specific movements which cause the onset of the problem. Let's say, for example, bending, and then look at the mechanics of forward bending and the muscular control involved with that. One of the other features that's often not talked about is this idea of muscle tone. Now, in general terms, we might think of tone as somebody appearing muscular and athletic, but muscle tone is a much more mundane, common application. And that really is this idea that the muscles that keep us upright against gravity and allow us to control movement need to work in a background without us having any conscious awareness of it. And that, to a large extent, is practical muscle tone. It's nothing to do with size and strength and athleticism. It's to do with having enough postural tone to support our body weight in different positions. And sometimes the postural tone and the mechanisms which stimulate muscle tone get switched on and off. Sometimes pain will have that effect. So pain can do two things. It can make some muscles go into spasm when something is acutely painful, but it also can have the contrary effect of switching off or inhibiting other muscles. And we'll often see in clinic people whose acute pain has resolved, but the muscle tone hasn't switched on. And you'll see that in other scenarios too. The ankle sprain is a really common one, where the acute soreness from the damaged ligament settles down, but the muscle control doesn't automatically recover. So that's why it's quite important to identify muscle control deficits and make sure that specific corrective exercises and regimes are put in place to not, so it's not left to chance, and then people are left vulnerable next time they repeat the movement or the test or the sports activity. So muscle tone, really, really important. Some people find it harder to maintain muscle tone than others. That can be to do with their lifestyle. It can also be to do with their general makeup. People who are loose jointed, what's technically known as hypermobile, find that they have to work harder to stimulate muscle in order to keep the muscle tone switched on. And that's an important concept, because people need to recognize that. And if you're in that bracket, it's about trying to find what is the optimal amount of stimulation that you need to do to keep your muscle tone switched on. I'm a great fan of body weight exercise, so you don't need equipment. You can use varying combinations of body weight positions to stimulate the musculature and make sure it's activated. And they're also then very good ways of you checking whether the system is still functioning well or not, rather than just hoping for the best. It's an interesting topic. We could speak in more detail on it, but I just wanted to make that point about the difference between just general core exercise and specific core exercise that is relevant to the direction of movement which has caused problems or which is vulnerable. And rehabilitation needs to particularly identify that, so that the corrective exercises are geared most specifically to those directions that need attention, and therefore are more likely to achieve a satisfactory outcome. Hope you enjoyed that little snippet of information. I'll see you again on another video. Bye for now.